one area of community organizing and policy and advocacy where that CHWs can not only get involved but lead is a lot of awareness to issues of that the queer community goes through over the course of a lifetime, because the childbearing years are going to look different. The older adult years are going to look different. And we see a lot of campaigns right now, especially with our older adults, around Alzheimer's and dementia just in general for the population. But we need to understand that that's going to look very different for the queer community in terms of how they're treated by professionals, how they are cared for, what differences that's going to bring. And so one of the ways that CHWs can really organize and bring awareness to this is to push for representation in these public health campaigns and say, that's well and good. How can we help the queer community relate to what you're saying? That really is one area I'm seeing a lot more public health initiative to fund at the grassroots level, and that's why we need CHWs there ready to run with that in general. Another area that I see CHWs really taking the initiative is with STI testing, HIV/AIDS testing. These are very scary tests sometimes. There's a lot of stigma around it. CHWs can absolutely take initiative in making that easier for them to access, bringing awareness to the issues of accessing this care to policymakers, and ensuring that we are having that representation in these conversations and bringing the care to where it's needed, not making them go searching for it.
And as Claire had said in her answer, it's really about storytelling, right? Telling the story is a strong advocacy skill for CHWs. Telling the story of real people, telling the story that isn't filled with myths and fake beliefs, but telling the story from a person as a real person. And so many times those stories aren't heard or they're lost. And so we really encourage our CHWs to tell the stories of their clients, of course, with permission, right? And in a protective manner. But those stories have had huge influences on legislation, on policies, on bills, and we're better to get them from than CHWs to tell those stories. We really also encourage our CHWs to recognize the power of the story and the power of what their patients and their residents and their clients have, who they are for real. Because people assume and gather information from here, there, and put a story together. But when you have the actual real story, it is so powerful. And CHWs have those stories.